Hello guys, welcome to All About Physiotherapy. Today our guest is Dr. Jodi PT DPT from Texas, USA. She is a specialist in sports orthopedic. She is not just a physical therapist but an athlete herself. She will be sharing her experiences and her knowledge with us today. Hello Dr. Jodi.
Hi, how you guys doing?
We are good. How are you?
Doing well. It's early in Texas this morning, but we're ready to go.
Yeah, thanks for taking time early in the morning and it's evening over here in India. So I wanted to ask you about, now we'll be going to the question answer session. Before that, I wanted to ask you about the COVID-19 thing which is going on in the world. Are your
Yes.
people safe over there?
Yes, we've actually been pretty self-limited and quarantined for the past a little bit more than 45 days now. We've probably got another 30 days here in Texas where it's a limited shelter in place. Luckily, in the field of physical therapy in the outpatient world, we're still considered essential. So I'm still able to see patients. We try to reserve that right mostly for our post-operative patients, for those who are in acute needs. But luckily, we've been able to stay open, and PTs here are having a little bit of a struggle as far as their caseload being low, but everybody's staying safe and doing their part, washing their hands. So how about you guys in India?
Here also, there is a lockdown. We are quarantined from maybe last month. It's a month now. And the cases are growing, but everyone is taking care.
Is the curve flattening over there?
What?
Are they flattening the curve? Are the cases slowing down, or have they increased over time?
Increasing, but the government is really working very well on that.
Very good.
I hope that the situation gets settled down soon.
Yes, sir. Me too. It would help everybody and help the economy for sure.
Yeah, we'll fight against that.
Yes, sir.
Okay, so ma'am, we'll start with the question and answer session.
Okay.
My first question to you is, how did you develop interest in the field of physical therapy?
How did I get interested in the field of physical therapy? Is that the question?
Yes, right.
So when I was growing up in high school, I was very active in athletics and sports. I also had a real passion to work with people and in the medical field. And so I had two options. I said either I'm going to go be a medical doctor or I'm going to be a coach. And then I found the field of physical therapy, and it's the perfect blend and merge of the two, to where you still get to coach your patients every day. You still get to work with people, and you're the front line of healthcare. We're the neuromusculoskeletal specialists, if you will. So you get to learn a little bit of everything, and you get to spend more time with your patients, ideally, than a physician would. So it's just the perfect blend, and that's always been very attractive to me. And I think it just worked out perfectly for wanting to, still pursue my athletic career, but also be able to work with people in healthcare.
Okay, good. So my next question to you is, for the past 7 years, you are been coaching and training CrossFit. Why is
Yes.
CrossFit different from any other training?
Yeah, that's a great question. So by definition, CrossFit is constantly varied functional movement at a high intensity. And I think the beauty of that is that it can be constantly varied, and you can do pretty much anything and design the program to be CrossFit, but it's really just exercise and movement. So it's not so specific of a sport to where, say, baseball, okay, we throw a ball, we hit a ball, we run around the bases, or basketball, you put the ball in the hoop. CrossFit is really just exercise under a time domain at a certain intensity. And so we can take that mold and we can modify it like an art, however we want to. And I think that's what makes it so nice for a PT is if you have an athlete who, say, is in love with CrossFit and that's what they do, and they say, hey, I have this injury, I can't do CrossFit. Well, you still can. You just modify the movements to make it safe for that person. And if you want to train at a high intensity, at a high level, you train at a higher volume, you work those high skill things. But if it's, say, your 65-year-old mother or your grandmother, you can still do the sport. You just modify it to where it's safe for them and they'll still get the same benefit. So I love the variability of it.
Okay, right. So as you yourself is a marathoner, but when it comes to training a marathoner, what part do you focus more when you train a marathoner?
As far as running goes, running a marathon,
Yeah.
I think the big thing for my runners is because you're doing a repetitive motion over and over, every step is the same motion, and it's going to be mostly in that sagittal plane. We want to make sure those athletes are training in their frontal plane as well for stability. So we look up at the hips, we look down at the ankles. Another big important part of that is shoe wear. If you're a pronator or you're a supinator, are you wearing proper shoe wear that's going to maintain more of a neutral ankle and maintain proper mechanics to reduce your risk of injury? But I think the important thing is, rather than just saying, hey, go run more, is that we train in other planes of motion, and that you add in some resistance training and also deloading, getting those athletes in the pool, getting them on the bike, training their cardiorespiratory system in different manners versus just that same repetitive motion over and over again. Try to preserve their body so they can do what they love to do.
That means endurance. Mostly you
Yes.
work on endurance.
Say that one more time.
So you work on endurance more.
Yes, absolutely.
Endurance. So how, and my next question is, how important is strength and conditioning for an athlete?
I mean, I think that's a broad question. I think it really depends on what the demands of the athlete are. If they are, just say the marathoner, for example, they're an endurance athlete, but they need to require a certain amount of strength and stability to have symmetry through their motion to reduce their risk of injury. On the other side of that, say you have a power lifter and they train only strength, but they lack the mobility to get in certain positions. I think taking a holistic approach of that and looking at, not only do we have strength and endurance, that we have balance, that we have proper range of motion through all of our joints, and that you can optimize all of those things to get the most out of your performance. And you don't really want to ignore any facet of your athleticism. You want to have a holistic approach.
Okay, so ma'am, tell us something about your daily routine.
About my daily routine.
Yeah.
I make sure that I am getting all my meals in. If I don't eat right, I can't do my job right. I wake up in the morning. I make sure I eat a good breakfast. That's typically going to be some type of oatmeal with a protein in that. I make sure I get my fats through some kind of nut butter. I'm very routine on what I'm eating. I show up to work. I'm seeing mostly about 5 to 6 patients a day. I am a cash pay performance physical therapist. So I'm seeing people for an hour to an hour and a half one-on-one. I do have a PT student that works with me as well. So between those 6 patients, I make sure grab my lunch midday, and then at the end of the day, I'm hitting my own training. I feel like if I'm going to expect my patients to meet a certain demand of physical performance, or even just health in general, it doesn't even have to be performance, just being healthy, that I should be able to walk that walk. And so I make sure I get my training in. I don't skip my workouts. I take care of my body as well. And then I get lots of sleep.
Yeah, we
I
have
feel like
checked out your Instagram profile, your personal Instagram page. We have seen how dedicated you are. We have seen that. So ma'am, coming back to the questions, first I wanted to ask you for the demonstration of some dry needling techniques that you were going to show us.
Absolutely. So I'm going to bring my laptop over with me. So this is a peek into my office here. I want to introduce you guys to my PT student. This is Casey. She is a doctoral student at Hardin-Simmons University.
Okay.
And she is going to be my stand-in patient today. So I'm going to get this just right to where you can see. I'm going to be dry needling the upper trap here. So there's a couple things that we'll have to do beforehand. Let me back up just a hair with my camera here. You see that okay?
Yeah, that's good.
Okay. So before we get started, I have already talked with the patient to make sure that there's no contraindications. I know her precautions. There's a long list of things we want to look at. We want to make sure that she's not pregnant. You can still dry needle in pregnancy, but that first trimester is definitely a major precaution. Some would call it a contraindication. So we've cleared that. She doesn't have any blood disorders, infections, cancer, the long list of things. So she's a safe candidate for dry needling.
So ma'am, we have to be more careful because there is the apex of lung over here. So we have to be more careful.
Absolutely. So we don't, when we're needling that upper trap, we want to make sure that we're not hitting the apex of the lung. When we needle, we're going to angle, we're going to go more superior and anterior whenever I'm doing the posterior fibers. We never want to go straight down or medial towards that lung. We're also going to be pulling that tissue up and away with what we call a pincer grip. So holding just like this to where I have cleared those fibers and now it's a safe zone to dry needle. So before we get started, we're going to prep the tissue. I've got some alcohol here. We make sure that we clean that area nice and good. And then I will be using what we call a Syrian needle. There's a bunch of different brands. Red Coral is also a good brand. I'm not here to advertise for anybody, but it's just a personal favorite of mine. I really like the Syrian brand needles.
I will show you my needle also after that. Okay.
Yeah, what dry needles do you use?
See, I have this one of 4 sizes I have. I'll show you after that. If you want, I can show you one.
Very good. I've got a 30 by 30 millimeter here. They're all single-use needles. So we're gonna pull that tissue up and away, pincer grip, okay? When I insert the needle, I'm making sure, again, I'm going superior, anterior. And what we're looking for is that nice active trigger point. So I have already done an assessment on this patient. I know that she's got some tightness through that trap. I know that she's limited with her left side bending, so we're dry needling that right upper trap. And we're gonna use a sewing technique today to try to get some of those trigger points. You doing okay? Mm-hmm. Good. We'll do a couple more passes here. And she may feel that refer up into the head. She may feel it up behind her eye and just localized within that area. So immediately after we dry needle, we do some ischemic pressure to that tissue. We can also come in and elongate and do soft tissue mobilization. So that would be the short version of what we're doing today. Whenever we're done dry needling, we don't just leave it at dry needling. I'm gonna get this patient up. I'm gonna have her doing neuromuscular re-education. I'm gonna have her doing some lower trap and mid-trap strengthening for stability, trying to restore her scapulohumeral rhythm, trying to restore posture as well.
Okay, ma'am, thank you. Yeah. Any other thing you want to show?
Casey, any other thing you want to show? So we can walk through some of the neuro re-ed that I would do with her following dry needling. You okay with that?
Yeah, fine. That's
okay. Let me have you in right sideline here and let's do a pillow. All right, so for this particular patient, she carries a lot of stress through her upper trap. So she's sitting up high like this. She's also got some weakness in her lower trap that we've tested before. And so we're gonna do some scapular PNF here to try to restore that lower trap. So I'm gonna bring her here. Can you stack your shoulders for me a little bit more? We'll get rid of these gloves. So you guys can see on camera here how she's got a little bit of winging through that scap.
Yeah.
That's something we don't want to see. We would like that shoulder blade to sit right there at rest. And so I know, because I've worked with this patient, I know she can get in that position. I just want to retrain it after we've worked on the trap. Now, ideally, because I dry needled her right side, I would be doing this on her right side, but for the sake of demonstration and because I know she needs it on both sides, I'm going to show you guys this shoulder. You get the idea. So we're going to get her arm in a position there, make sure she knows that set position. I'm going to start with just an isometric hold. So we're going to find that inferior angle of that scap, and I'm going to give her just a very gentle hold right there and have her match my resistance. If she can match that without compensating with the upper trap, we're ideal there. Now I'm going to see if she can melt away into an anterior elevated position. And I don't know if you guys can see, but what happened there was she actually protracted. She didn't come up into an anterior elevation. We want to try to stay right on that line. So just go ahead and just relax for me, Casey. Right on that diagonal of anterior elevation, posterior depression. And so for this particular patient, I would teach her that with passive motion first. We call that rhythmic initiation through PNF. We take her through the motion passively, and then we do some alternating isometrics, alternating isotonics, and just getting those muscles to learn how to fire so she's not so dominant through those tonic muscles, the big upper trap, the pectoralis major, wanting to protract, and just learning to refire that lower trap.
Right, right. Yeah, very
Sound good?
important. Yeah,
Yes.
thank you, thank you. Thanks a lot.
All right.
Yeah, so coming back to questions.
Yes.
Yes, ma'am, I've read about you that you also perform cupping techniques.
Yes, I do cupping as well. So just like dry needling, I think cupping is a great tool for your toolbox. I will never rest on the fact that there's one thing that's a cure-all. I think it takes a whole lot of different interventions to make you a great therapist and for your patients to reach their goals. So in instances where I have patients that have severe myofascial restrictions or say scar tissue restrictions, maybe they are just very hypersensitive and they don't tolerate dry needling, but they need to have some softening or loosening of that tissue. I think cupping is a great technique. I really enjoy doing cupping in the form of an active release technique to where, say if we're working in the scapular position and I've got some tightness through my rhomboids, my levator, I can get some cups in those areas and have the patient protract, retract, go through some active side bending or coupled rotation to loosen that tissue through an active motion, a little ART. I also do cup gliding techniques to where instead of just leaving those cups in situ, that we're actually gliding over the tissue to get a little bit more pliability through that area.
Which we call the dynamic cupping.
Yes, absolutely.
Okay.
You got it.
Yeah, there are many techniques like even people do ice cupping, fire cupping, hijama.
Do you guys,
yeah.
Y'all do fire cupping over there?
Yeah, we do fire cupping also. We also do hijama over here. Then there is static cupping, dynamic cupping, ice cupping.
Yes.
Yeah.
So
ice is also good for recovery.
Say that.
When we go to marathons, I have done ice cupping on the runners, and it gave good effect.
Good effect. I've never done ice cupping before. I think it'd be interesting to try that. I'll have to look more into that.
Yeah, try it because the muscles, when we apply the pumps, the muscles comes up, the deep layer comes up, and the icing effect gets easily into it.
Nice. I need to look into that for sure. See,
I'm
learning something here today. Yeah. That's good. Yeah. Otherwise, what modalities do you like to use? What are some of your favorite things?
We also perform IASTM, which is instrument assisted soft tissue manipulation.
Absolutely.
And then kinesiotaping.
I'm certified in Graston Technique. In my old practice where I was at the last 6 years, we used Graston instruments. I recently started using a sidekick tool. Same concept. There's so many out there now. I mean, it doesn't really matter what you use as long as you use it the right way.
And so many tools are there.
Yeah. So again, I like to prep the tissue. Like I'll prep it with STM, IASTM, cupping to desensitize that neural system. And then we'll go on with some dry needling, finish with some neurorad and therex. I think the therex part is the most important part, honestly. I think a lot of times as PTs, we miss that mark where we get so excited to do our manual therapy. And you know, we get caught up in our interventions and then you don't have much time left to teach people how to manage it. And some would argue, well, that's what keeps you in business. But I think the important thing here is we're here to help people get better and rehabilitate and not just make an extra dollar.
And we have seen recently that the actors from Bollywood and Hollywood, they do TRX. So what is the difference? What is the best effect that you get from TRX?
TRX. Okay. Yeah. So I'm TRX certified too. Got a lot of tools in my toolbox. I think TRX is another tool, just like Peloton is getting to be a big thing. I think it just depends how you use it. You know, everybody wants another really like flashy, shiny thing to get them better. I love the simplicity of TRX. I love that you can put it anywhere. You throw it over your door, you tie it to a tree. I think the beauty of TRX is that it's still functional movement and you're moving your body in space and you have to be in control of that. So it helps with not only, you know, your strength, mobility, stretching, but your proprioception. And If you can be in better control of your body movements, then you're less likely to get injured. So I think that there's certainly a place for it. And I wish more people would learn to use that, because it's so easy and so simple. And it also helps deload the joints, and there's nothing like preserving our joints.
Yeah, right. So I've seen the logo of yours, which is a barbell shape. And just now at 4 p.m., I've interviewed the barbell doc, Dr. Ryan from
Yes,
Washington,
I saw
USA.
that. I saw that.
Yeah.
Very good.
So I wanted to know your perspective of barbell training.
Sure. So in my logo, I actually have the kettlebell, which is right up here in my screen. Are you asking about kettlebell or barbell?
Yeah, kettlebell.
Okay. I enjoy doing both. I don't really have a bias one over the other. I think that the benefit of kettlebell training is that kettlebells are a lot smaller. They're easier to transport anywhere. They're pretty easy to come by. I feel like with the variability in weight, you can still load like you need to. So if I wanted to load a squat, I can squat in a goblet position. I can go double front rack. I can hold them in a suitcase or farmer's hold, and you can have so much variability. But I can also work explosive movements. I can do a kettlebell snatch. I can do a kettlebell push press, a push jerk. And I think the difference more so between a kettlebell and a barbell is that with a barbell, you're typically going to have both hands on that barbell. It's still an open chain activity, but a little less dynamic. Whereas with a kettlebell, it's a very dynamic open chain activity. And so you get to work on a lot of stability of, say, those little tiny steering muscles, your rotator cuff, your wrist stability. If you're doing stuff with your legs, it just really challenges, again, that proprioception balance stability aspect a little bit more than a barbell would. So I think they both have, their pros and cons. I just like the portability and the variability that you can use with a kettlebell.
Right. So there is a personal question to you, that
Sure.
Who has been your inspiration in these days, and why?
Say that one more time. Sorry, I couldn't understand you.
Who has been your inspiration and why?
I've got two people. Dr. Brooke Miller. So she is a physical therapist here in Texas. And I remember listening to a podcast about her starting a practice just like mine. So she is a out-of-network cash pay performance PT, and she was working in a CrossFit gym. And she's treating patients in this gym how she wants to for a long amount of time, and doing what's best for the patient. I'm like, well, if she's doing that, why can't I do that? And why do I have to be confined by insurance? In the U.S., insurance is a big gatekeeper for, our plan of cares and how long we can see patients and how we treat them. And, financials kind of come into play. And so we have a little bit more freedom as a cash pay clinician. So she's kind of what got me started. And then Dr. Danny Mattei, he has, I don't know if you've heard that name before. He put out a course that kind of helped me get started with my business and really understand that I should be working for people and not for insurance companies. There's a ton of them out there. Kelly Starrett, Gray Cook. I mean, some of these big names, performance PTs, just gurus that, you kind of pull a little bit from everywhere. And then of course your family. I wouldn't do this if I didn't want to make my family proud. And they helped me get through PT school, and we all know PT school is not easy. It's a challenge, man. It's a journey. So I think I'm inspired by different people for different reasons, but it does take a village. And I know that I wouldn't be where I am without a ton of people just pouring into me and inspiring me. So that's a great question.
Right. So any advice that you would like to give our physio students to achieve success in life?
Yes. Win the day. Take it one day at a time, because there's so much in school that you're learning, and it's complicated to say, like, am I going to retain all this information, and am I going to be able to pass my board exam? And I think if you take one day at a time and you just wake up with that mindset to win the day and make the most of your day, collectively, you're going to get through it. And then once you graduate, start looking at, what's next, just one step at a time, and just know that if you win each day, you're going to win the month, you're going to win the year, and down the road, it's going to work out for you. But just take one thing at a time. Don't get too overwhelmed with the big picture.
Right. So, ma'am, have you ever been to India?
I have not. It's funny that you asked because I just became friends with a couple of people that are from India, and they were just raving about how much they loved it. They went over there for a wedding, and yeah, it's just funny. It was good timing that you reached out because I've had kind of that connection with some Indian friends.
Yeah, whenever you want, you can come here. We'll welcome you with open arms.
Where are you located at?
We are in Mumbai.
Okay. Do you know how long the flight is from US over to India?
There are many flights. There are many flights.
We'll have to look into it. We'll see. I would love to though. And same thing for you guys. If you ever venture over to the US, come on down to Texas. We'll show you the ranch way.
Sure. Many Indians wants to come there and practice, and will surely come to meet you one day.
You bet. And if you need anything, and if your students need anything, tell them to reach out. You guys can find me on Instagram, BODYWORX_DPT. I have a website you can find me, Facebook. Just look up BODY WORX Physical Therapy in Texas, and you'll come across me. And I'm more than happy to answer any questions or have people pick my brain. I'd love to help.
Are you planning to have any courses online or something like that?
Eventually. So I just opened my practice 3 months ago. I really want to get this up and running. I'm playing around a little bit more with doing Facebook Live, being more comfortable with putting content out there. I think my year plan would be to start really niching into what I would want to offer. If I did, it would be movement based. Teaching people just how basic fundamental movement, and then breaking down each joint and saying, okay, if we look at the air squat, I think that's such a great dynamic functional movement that we all do every single day. And looking at, okay, you have to have ankle mobility, certain hip stability, certain lumbopelvic stability. There's so many components that go into it, and I think we could really oversynthesize that. But I would love to do movement-based courses. I think that'd be great.
Okay, ma'am. So we are coming to an end, and we would like to thank you for your valuable time. And
yes.
It's really a pleasure to interview you. Thanks for your time.
Well, thank you so much. I look forward to talking to you. Good luck and best of luck to all your students.
Yeah, thanks a lot and take care. Bye-bye. Have a good day.
Bye-bye.
Bye-bye.